Today, we talk about a topic that not only 20 million Americans suffer from, but actually over 200 million people worldwide suffer from, and that's thyroid issues. In this video, I'm going to give you the complete layout on thyroid issues, what your doctor is not telling you, and what's truly going on with your specific symptoms. And it's much more than just throwing thyroid medication on it or just taking some supplements. There is a true root cause, and in this video, I'm going to treat and help you with giving you recommendations on how to heal this chronic issue. So, to begin with, either you're suffering from hair loss, fatigue, insomnia, depression, anxiety, or weight loss, resistance, or weight gain. So, you go see your doctor, maybe your endocrinologist, and you run a lab test and you get your TSH back. And in one scenario, your TSH is normal, but you still deal with symptoms. And in one scenario, your TSH is off, and now you're getting levothyroxine, Synthroid, or some other thyroid medication. Now, no matter what medication you're getting, none of it's correcting the true root cause. And so, with that being said, though, first things first is you just getting a TSH reading or a free T4 reading from a reflux is not even getting a full picture of what's going on with your thyroid gland. And this actually leads to the next symptom is that if you're someone who has normal thyroid levels and your labs are normal and you still deal with these thyroid symptoms, then you could be dealing with, which majority of people are, cellular hypothyroidism. Okay? Just because your thyroid numbers, like even T3, is in an optimal range, it still sometimes cannot get inside the cell for it to be properly used. And that's what cellular hypothyroidism is. And so no matter what you're doing, you're taking thyroid medication, still deal with symptoms. You have fine thyroid levels, but you're still dealing with symptoms. Yet nonetheless, okay, there are so many things that could be going on inside. But first, we need to understand that your doctor, your endocrinologist, conventional allopathic medicine is looking at just the thyroid gland as it doesn't impact anything else, which is faulty because your thyroid interplays with every other cell within inside your body at other tissue levels. Okay, so what I mean by that is that your thyroid gland isn't just influenced by your thyroid. It gets influenced by other areas as well. And so when we look at it though, from the hypothalamus releases something called TRH, which is thyrotropin releasing hormone. It signals to your pituitary gland, which is almost like a master, gland in your brain that regulates a lot of things inside your body. Okay, and from that pituitary, it releases TSH, which is normal, which you know as because you get tested for it, and then it signals to the thyroid gland. Okay, and majority of it is T4, and then some of it's T3, but that majority of T4 is unbound, so it has to convert into the active form T3. But the activation doesn't just happen in the thyroid gland. It happens in other tissues as well, like the heart, the gut, the liver, and peripheral tissue. So all those have to be correct. And as you'll see, if you have either leaky gut bacteria imbalance, inflammation, stress, whatever, that will impede on your thyroid conversion and even synthesis. So to rewind here though, you're suffering, majority 20 million people worldwide, okay, not just in America, worldwide suffer from thyroid issues. And it's because your doctor is looking at it like it's just the thyroid gland that needs to be treated. Okay, this is how allopathic medicine is. Okay, it's symptom, treatment, drug, or procedure. That's how they do it. It is not your doctor's fault, though, in the beginning, because that is exactly how they've been trained. So, to begin with, what are some of the true root causes of thyroid issues? A big one is nutrient deficiencies. Now, if you're taking medications like PPIs, birth control for females, or whatever, it depletes important nutrients like vitamin A, B vitamins, selenium, zinc, iron, vitamin D, and all of these are needed for thyroid hormone, okay, for thyroid synthesis, for creating thyroid hormone or whatever. Okay, so if you're deficient in any of these nutrients, that will impair thyroid function, therefore giving you the symptom of weight loss resistance, fatigue, hair loss, depression, anxiety. Next is environmental toxins. If your liver is backed up, which is the main chief detoxifier for your toxins is your liver. Okay, if your liver's backed up, it will impair thyroid function because it will not, it won't remove the excess toxins out of the body. And so by doing that, it'll recirculate back into the body. The toxins will recirculate and actually end up impeding on the thyroid gland. So, with that actually being said, though, a majority of hypothyroid issues are actually about 90% is actually Hashimoto's thyroiditis. But you wouldn't know this because your doctor's not running an antibody lab test. They're not running a TGA, TAB, or whatever TPO to assess if you have antibodies elevated, therefore giving you Hashimoto's. Okay? And this should be noted though, because this is another reason why you're not getting well on thyroid medication, because it's not actually correcting what is the root cause, which is the overactive immune system. So you actually have to go to what is causing your immune system to be attacking your thyroid gland. Okay. Synthroid, levothyroxine, triacin, cytomel, armor, whatever is not correcting that autoimmune condition. Okay, so that was a side tangent, but going back to what are the things that affect thyroid issues? Gut infections, okay? If you're dealing with gut dysbiosis, leaky gut, either of these two things, which has been shown in data, real data, that if you're dealing with any type of bacterial overgrowth, like SIBO, small intestinal bacterial overgrowth, or if you have an IBS label, that could be an indication that your thyroid gland is off, and it is actually a root cause to why your thyroid gland is off. Okay, so this is important. Food intolerances. If you have a bunch of food intolerances, that truthfully means you have poor intestinal lining health, aka you have intestinal permeability. And so, with that being said, if you're getting all these food sensitivities from pretty much all these foods, then it's causing inflammatory immunological responses inside your body, therefore triggering your immune system, which then, like I said, about 90% of you that struggle with hypothyroidism actually struggle with Hashimoto's. That will actually impair your condition. And so next is hormone dysfunction. If you deal with estrogen dominance or low progesterone, that can impede on thyroid hormone. That can cause you to have thyroid issues because your thyroid plays, a negative feedback loop with your estrogen in your body. And you have three forms of estrogen: estradiol, estriol, and estrione. So if any of those are off, which majority of the time estradiol stays elevated for a lot of individuals that struggle with everyday lifestyle diseases, that will in effect your thyroid gland. Okay. Stress, big one. So stress coming from either severe caloric restriction, yo-yo dieting, overtraining, or whatever, this stress will actually impair your ability to convert the hormone properly from T4 and T3, or just thyroid synthesis in itself. And this is actually a main driver because stress brings inflammation. Okay, but when the stress becomes chronic, then it becomes chronic inflammation, and that inflammation can get into a cellular level. And so what happens now is that, like we talked about before, cellular hypothyroidism. Now you struggle with cellular hypothyroidism from so much stress you have on your body. So even though your lab values are completely fine, you still struggle with symptoms because it's at the cellular level. And so hormone T3 can't get inside your cell to do its physiological job. Okay? So you living in fight or flight is destroying your thyroid gland, therefore, in most cases, causing autoimmune conditions like Hashimoto's and sometimes celiac and Graves' disease. So we just talked about all this about thyroid. What can you do to actually fix your thyroid issues? So to begin with, we need to figure out what is the why behind, what is the root cause analysis of your thyroid issues. Majority of the time, the best thing you can do is kind of get an entire picture. Okay, looking at TSH, free T4, free T3, reverse T3, TPO, TGAB. These are all hormones that you can get tested to figure out what's truly going on with your thyroid gland. Okay, from there, if you figure out anything is wrong, then you can start by fixing which lab values were off. But let me state this though. Do not always look at your lab values. Do not just look at a number to determine how you feel. One thing to note, and I've learned this from other functional integrative practitioners, you have to know how you feel above all. You have to feel good. Okay, don't just chase numbers. You have to know how you feel. Even if your numbers are in range and you still feel off, there's something wrong. You know when there's something wrong. Advocate for yourself. Okay, but checking thyroid full picture, thyroid panel would be a great start to figure out what's really going on. Next is to address any gut issues, over excess inflammation, stress, and toxicity. Okay, I do this all in my program anyway, but with that being said, understanding that if you have any like SIBO, small intestinal bacterial overgrowth, hypochlorhydria, low stomach acid, or you have poor liver detoxification, or you have too much stress, you have adrenal dysfunction, all of these things will be a root cause to why your thyroid is off. And this is why I correct it all head on in just a few weeks in my program. But you have to address that. Next is to implement an anti-inflammatory diet. So this is making sure we have a diet that's more Mediterranean type. Some like to go autoimmune paleo, whatever works for you. But majority of the time, you want to eliminate common food allergens like gluten, wheat, soy, corn, dairy, obviously processed food, artificial sweeteners, and things like that to eliminate food triggers and sensitivities for a time being. That doesn't mean you don't reintroduce it back in, but for a time being to remove the excess inflammation within inside your body. Next is to make sure you have your blood sugar balance, okay? Insulin plays huge roles with all other hormones inside the body, but making sure that your blood sugar is optimal for proper thyroid conversion. Next is to support with micronutrients for your thyroid gland. So, as we stated before, there's many nutrients that help with the thyroid conversion and synthesis. So, if you want to take a supplement perhaps that supports all those micronutrients needed, such as Thyroid Boost, which I have linked below, you can use specific supplements like that that support the conversion, synthesis, and all of the functions of thyroid hormone. Okay, next is addressing your stress and adrenal glands. This is imperative here because when you correct your stress and your adrenal glands, you can actually get out of that sympathetic dominant state that's keeping you sick and go into a parasympathetic dominant state, okay, where you can rest and digest, recover. Okay, that's when you start to heal. And lastly, we want to support phases 1 and 2 of liver detoxification. Now, I have videos all over my YouTube on how to do that. But with that being said, you want to have specific nutrients and antioxidants inside your diet or in supplementation form to help with removing the excess toxins out of your body or excess estrogen, truthfully, because that can hinder thyroid hormone. Okay, remove it out of your body, okay, for obviously optimal function and for healing. Now, this was a lot of information, but if you have any questions, please feel free to comment below. And if you're looking to get to the root cause and heal your thyroid condition and finally get back your life, then I want you to message me root cause today. What I want you to do though is if you just email me directly, it goes to my spam. So what I need you to do is book the call inside my website. That is exactly how you can get a hold of me, or you can give me, a text or whatever. But introduce yourself or whatever. But if you want to end this fatigue, you want to end the insomnia, get to the root cause and be a part of all the success stories, then let's do it today. Thank you.